When I was in my 20s, I had a serious Candida infection. So, if you're not sure what Candida is, it's a fungal overgrowth in the body, and it can show up not only with symptoms in your digestive system, but it can also show up with symptoms all throughout the body. Now, a lot of people are probably familiar with Candida because we thought that everybody had Candida back in the day, and it was really talked about a lot. I also had a sugar addiction, and my dad would always throw these diet books at me. He would always recommend new cleanses. And a lot of times that provided a little bit of relief, but for me, it just wasn't a long term solution. But it wasn't until years later, and I mean, when I was in my 30s, that I realized that Candida wasn't my only issue. And it really involves a lot more typically when you have a Candida infection because Candida likes to thrive in certain environments. So I like to think about it like I do a shark in the ocean. You know, if you have a shark, then there's going to be little fish that are swimming behind that shark because they're living off the scraps from the shark. And Candida are very similar in our body. They flourish alongside things like parasites, heavy metals, and a high sugar diet, which is exactly what I lived on. Parasites like to live inside a host, and oftentimes we're the host. So they can be microscopic, which means that we may not be able to see them, or they can be like worms. So that could be roundworms, flatworms, tapeworms, and it can be liver flukes. And a lot of times we don't think about the eco parasites, and those are the things that actually live on the host instead of in the host. And those are things like lice and ticks. So we can get Lyme infections from the ticks. And parasites, we also think about those and we think, oh, well, this just happens in undeveloped countries. And the reality is that parasites happen to people who live in the United States all the time. They're actually a natural part of our ecosystem. We just don't want to get infected with them. When our immune system's a little bit depleted, we can have problems and symptoms show up because of that. Now, what are some of the common symptoms? Well, we can have digestive issues, which actually makes a lot of sense, right? Because they'll often reside in our digestive tract. That's going to lead to a lot of symptoms like diarrhea, constipation, bloating, gas, abdominal pain, and we can also experience fatigue. So these bugs will be systemic. They'll be throughout different organs. They can get into our joints, different tissues in the body. And they also rob us of nutrients, particularly things like iron, and they'll cause anemia, and it also leads to exhaustion. We can get skin conditions. So a lot of things like rashes, itching, hives, eczema, those can be traced back to parasitic type infections. Allergies. And this can be to food allergies. This can be to different environmental allergies. People may experience things like sneezing, coughing, or other like allergic type reactions. Other symptoms that you may not think about are either weight gain or weight loss. You can get fever, headaches, eye floaters, seizures, muscle and joint pain, chronic respiratory issues, and even things like anxiety, depression, and mood swings, as far as like from mood disturbances, sleep disturbances, and even autoimmune type reactions. And like if we look at this from a traditional standpoint, it's often misdiagnosed or not diagnosed at all. And I see this a lot with IBS patients. So I was working with this woman. She had IBS, chronic symptoms, diarrhea, stomach pain, and she made a lot of dietary changes. But when we looked a little bit further, we actually found out that she had a Giardia infection. Now, this was missed on traditional testing, but that highlights the importance of looking at other things outside of just a stool test or just testing to be able to determine whether or not these infections are a problem. So how do you get parasites? Well, you can get them pretty much from anywhere, but a lot of the most common places are contaminated food and water, and they will be consumed through undercooked meat. They can be on your fruits and vegetables that are not really washed very well. We can get them through skin contact. So if you're walking barefoot in the grass, you can get hookworms. I do recommend grounding, but the reality is that we are exposed to some of these parasites in our yards. They can come in through insect bites. So a lot of times we think about mosquitoes as a source. You know, they were a source for malaria, So, and ticks, again, can also transmit Lyme disease and other parasite infections. They can be transferred from person to person. So if you have a pet as well, couples will also share a lot of the same parasitic and fungal type infections. So if you're addressing parasites in one person, it's really good to address them in the whole family. And when we're traveling internationally to developing countries, there's a significant increased risk there. So it might be good to even take like a prophylactic anti-parasitic when you're going into these places where sanitation is not as good. They don't have as great of hygiene practices, because these are really hot spots for parasitic type infections. Let's talk about testing, because everybody wants to know, what type of test do I need to take when it comes to parasites so I can get a diagnosis, so I can treat this? Well, one of the significant challenges to parasitic infections is that there's limitation in the testing. And the reason is that these tests are only designed to really detect a select range of species. So we're potentially overlooking a lot of others. And that limitation can actually lead to inaccuracies in diagnosis. And a lot of times in traditional medicine, if we don't see anything show up on a test, then we just chalk it up to, oh, we must not have parasites. But there are more comprehensive stool tests outside of traditional medicine. Now, they're still not going to catch everything, but when you're looking at it from a functional medicine standpoint, you're looking at the full picture. You're really looking at a lot of the clues that come in, whether parasites may be on a test or not. And we're addressing the whole picture through history, assessment of symptoms, other lifestyle factors, because they all could be playing a role. When you're cleansing parasite infections, I want to talk about that too, because whether you go the traditional route or the functional medicine route, you're going to probably see two different approaches. Now, if you're looking from a conventional standpoint, they are really going to be addressing these things with just a pharmaceutical drug, right? They're going to use a anti-parasitic, and sometimes they're great at killing the parasites. But one of the downfalls to that is they do not address the biofilm, and they do not address the internal environment. And what I mean by that is these parasites are inside your body because you've become a good host. If you don't work on the things that are causing these parasites to want to live inside of you, then you're still going to set yourself up for risk in the future. When we look at this from a functional medicine approach, we're really looking at the entire ecosystem of a person. And this not only aims to get rid of the parasite, but it also helps us create an environment that these parasites don't really want to live in. So we do that through diet, stress management, sleep. We work on liver function. We address the stomach acid levels, leaky gut, and any other imbalances in the microbiome. And we create a really healthy microbiome in the end, feeding it with good nutrition so that we're creating good, healthy stomach acid that these parasites really don't want to live in. So when we're exposed to those things in the future, they're going to pass through. They're going to realize it's not a good home for them, and they're going to continue on their way out. We don't have to worry so much about having these issues long term. So if you have recurrent infections, I've worked with people who said, hey, I've had a parasite infection. They keep coming back. Sometimes it's important to do full moon cleanses on a periodic basis. Some people do these once a year. Some people do these every 6 months. Some people do these every few years. And I'm just a fan of when my body's not feeling great, I'm going to do something to improve the health of my entire system. And parasite cleanses are a great way to do that. But I would start with a full cleanse first. And then if you need to do full moon cleanses for maintenance, that's totally fine. But if you're suffering from a recurring infection, I want to tell you about this client that I worked with. She had been on a lot of different treatment plans. She had also been just taking herbs, and she was kind of rotating them periodically. And it was a similar protocol that I did whenever I had fungal infections. You hear just rotate the herbs so that you trick the bugs. Well, the truth is that there's more to the picture than that. So we used a combination of diet, stress reduction, And we worked on one of the things we found called leaky gut. You might be familiar with that term. And we implemented a process. And I use a 6-step process to help a person's body heal so that they can get symptom relief long term. And when we create an internal environment that these parasites don't want to live in, then we're going to start living in better health. So when it comes to addressing infections like this, I do help work with people to address this with a step-by-step plan. We look at genetics, environment, diet, other lifestyle factors. We do a comprehensive assessment, and then we also aim toward looking at underlying causes, things that might be standing in the way of you healing. So we would do an initial consultation. We would do comprehensive testing. We would build you a customized plan, follow up with adjustments in your protocol and your supplements, and then create a long-term plan for you. So if you're curious about whether or not this is a good next step for you in your journey, please take a little bit of time. I'll put a link in the comments so you can share a little bit more of your story with me, submit an application, and I will invite you to schedule an appointment with me, and we can talk a little bit further about that. If you're looking for other ways to connect, you can also do that by purchasing a copy of my book, Healed His Way. It's also on Amazon. And we have another gut and immune masterclass you can check out as well.